Other provinces across Canada, like Nova Scotia, are giving their citizens easy and affordable access to rapid tests. But for some reason, rapid tests remain elusive in BC.
The user experience in testing is very important because anything that is considered a barrier to testing will ultimately decrease population uptake. When we look at PCR testing, especially now in British Columbia, with many of the testing sites closed, it makes it difficult. People have to travel by car, by public transport to get to a testing site. Sometimes it takes hours to get there. People in some areas have to book a testing, and sometimes the testing is not available until days later. They still have to wait for a result. And again, that could take days. Meanwhile, during those days that they're waiting for the result and not getting tested, if they are infectious, they've already contributed to secondary, tertiary chains of transmission. If we look at the rapid antigen test user experience, this is much more comfortable, accessible, and gives you a result in a short period of time so that the individual can act on this result. The thing to remember about COVID is that there is a significant proportion of individuals who are causing transmission chains when they have no recognizable symptoms. So with the rapid antigen test, what you're really getting is diagnosing people during this peak of the curve when they're the most infectious. If we truly want to compare PCR tests with rapid antigen tests, then we have to be asking the right question, meaning if the test goal is to determine if someone has ever been infected, then maybe PCR is better. If we ask the question, are rapid tests accurate in identifying infectious cases, then the answer is yes. These rapid antigen tests are much more accurate than PCR tests to tell us if someone is likely in their most infectious phase. If we have a false positive on an antigen test, do another antigen test. We're not relying purely on the antigen test to make a diagnosis. So positive antigen tests will get confirmed by PCR. And in our experience of confirming PCR, we have rarely found any false positives.